Hello everyone, this is Dr. Puja Sharma, Senior Consultant Obstetric and Gynecology from Delhi South Hospital. So today I'll be talking with you about best days to get pregnant. For all the couples who are planning pregnancy, they must have an idea about the best days to get pregnant. So what are these best days? So before knowing what are best days, let me tell you what is fertile period. So fertile period is the time when the lady ovulates. Ovulates means when the egg ruptures from the ovary, and that is the time when, if husband and wife or the couple is together, there are most chances to get pregnant. So let me tell you what is ovulation and when does it happens. So the timing of ovulation may vary from female to female depending upon the length of her menstrual cycle. So some girls may have ovulation early, some girls may have the same later. And why is this so? This is because every girl has a different length of menstrual cycle. Suppose a girl has a menstrual cycle of 28 days. For that girl, the time of ovulation will be different from a girl who is having a menstrual cycle of 21 days. So how do we calculate the day of ovulation? Day of ovulation is calculated by subtracting 14 from the total cycle length. So let me give you some examples. Suppose a girl has a cycle length of 28 days. So 28 minus 14 will be somewhere around 14. So for that girl, the day of ovulation will be day 14 of her menstrual cycle. Whereas for a girl who is having a menstrual cycle of say 32 days, for her 32 minus 14 will be somewhere around 17-18. So her ovulation day will be day 17th or day 18th. Similarly, girls with short cycles, that means if anybody is having a cycle length of 21 days, for her the day of ovulation will be 21 minus 14, and that will come out to be somewhere around day 7 or day 8. So you have to keep a track about your cycle length, and you start calculating the total duration of your cycle from the first day of your menstrual period. The day you get your period is considered as day 1, and from there you calculate your cycle length. After knowing your cycle length, subtract 14 and you will get your day of ovulation. Now, once you know that, okay, this is my day of ovulation. So what happens? Why is it important? It is very difficult to calculate your fertility exactly, but you can approximately estimate that if the couple is together 48 hours before to 48 hours after ovulation, then the chances of conception or getting pregnant is maximum. And why is this so? This is because the life of egg in a female's body is somewhere around 12 to 24 hours, whereas the life of sperm in a female's body is somewhere around 1 to 5 days. So if the couple is together from 2 days before to 2 days after the day of ovulation, that is a window period of somewhere around 6 days, if they have contact even on alternate day basis during this period, then the chances of conception are maximum. And this period, 5-6 days window period, is known as the fertile days. So let me give you an example, as we were talking about a girl who has a cycle length of 28 days. So for this girl, the day of ovulation will be day 14, and 2 days before to 2 days after means from day 12 to day 16. So these are the best days for this girl to try getting pregnant. So the couple should be together on alternate day basis during this time period to increase their chances of getting pregnant. Now, there are certain natural methods too by which you can assess that, okay, I am somewhere around my ovulating days. And what are those? Number one, at the time of ovulation, the vaginal discharge, the mucus, it becomes thin, stretchy, watery, just like egg white. And it is because of the increase in level of female hormones in the body. So, by looking at your vaginal discharge, you can assess that, okay, if you are getting a thin and a stretchy, copious discharge, then you might be somewhere around your ovulating days. Second thing is your basal body temperature, which means that temperature taken when you are at rest. So simple way to measure is that get up early in the morning and take your temperature by an electrical thermometer. And if your temperature, normally the temperature is somewhere between 97.2 to 97.6 or 7. as you progress from day 1 to day 14 of your cycle, at the time of ovulation, there is sudden rise in body temperature of about 1 degree Fahrenheit. So when you notice this rise in basal body temperature, then anticipate that you might be ovulating in next few days, right? Third thing is some girls may experience lower abdomen pain or even spotting at the time of ovulation. Few non-specific symptoms are breast soreness, alteration in moods, alteration in sense of smell. So by keeping a track of your menstrual symptoms, you can assess your fertile days, you can assess your ovulation days, and believe me, if you keep a track properly, then it will enhance your chance of getting pregnant. So girls, maintain your menstrual calendar, keep a track of your menstrual cycle, and remember about the best days to get pregnant. Thank you.